Good morning, everybody. It's Dr. Galvin with another update. Just worked my third night in a row on a holiday weekend, and it was busy. For the second time in 2 weeks, the hospital was completely full. Now, I have worked at this particular hospital part-time for about 18 years. I started almost as soon as I got out of the military. And I joined a group in North Carolina, but my neighbor was a director at the particular hospital I'm at now, and they needed some help. And so I've worked up here on and off for a long, long time. So I know this hospital pretty well. And in those 18 years, until about 2 weeks ago, I'd never worked where I came in and was told that there's not a single bed of any type in the hospital. No ICU, no regular medicine, surgical, anything. And that happened about 2 or 3 weeks ago. The hospital was completely filled with COVID patients and everything else. And guess what? It happened again last night. The hospital is completely full. Now, that's an unusual thing. And that's because in the summertime, this is sort of our slow time. We don't expect the hospital to be full. We expect to get slammed when the wintertime comes. So come late October, November, that's when all the winter viruses and pneumonias and lots of people get sick in the wintertime, flu, and that's when you expect the hospital to be slammed. For it to be slammed now is very, very concerning, because what happens if we're completely full and every other hospital is completely full, and we get inundated with with more COVID patients, which unfortunately may well happen in the fall. Now, why do we keep talking about this worry about increased number of cases in the fall? Well, for one thing, these viruses tend to have a seasonal component, and they tend to worsen in the wintertime, but also, just logistically, what happens in the winter? We tend to be inside, which means we congregate. And if we're not taking precautions, then we're going to get exposed. One of the important things to realize why this winter is going to be different than next winter is that, remember, when this virus started, the virus was, pretty sparse. When we started seeing cases in March and March and early April, it was not very prevalent in the community. So your chance of getting it was pretty low, because you'd have to run into somebody that had it. Now we've had 6.4 million cases. It's broadly in the community. So now when that community comes back together in their homes or businesses or wherever they are in the wintertime, your chance of getting exposed to somebody is significantly higher. And that's one of the concerns. And there's some modeling that has some very sobering thoughts about death numbers in the U.S. if we don't really double down on the masking and things like that. And I posted yesterday, and still there, even today, after everything we've seen, people are still saying, well, I don't believe it. Well, that's fine. You don't believe it. You can, don't believe it as much as you want. It doesn't change the fact that it's happening and it's true. And I'm seeing these people every day, and people are dying from this virus, and we need to take this seriously. Right now, our numbers are increasing in the U.S. still in 22 states. North Carolina is actually doing pretty good. Last time we looked, I think our case positivity rate is down to almost, 6%, which is great. But there's 22 states where it's rising. And, if it rises into the fall, we're going to really have some big problems. I've been asked questions about the vaccine and, am I going to get the vaccine? Well, first of all, there isn't a vaccine. There's multiple vaccines being studied. If one is available November 1st, am I going to get it? No way. I don't think that there's any way you can adequately safety test a vaccine like this by November. When do I realistically think that we're going to have a vaccine that is safe to use? I would think maybe in the first quarter of next year, maybe. I'm in a population that's going to be forced to get the vaccine when it comes out, just like I'm forced to get a flu shot, because I work in a hospital and I get exposed to people all the time, and I may potentially expose people. So I understand that I'm going to be mandated to get a vaccine, but I certainly hope that it's going to be safe. And I really want to look at that safety data. And I promise you that as I look at it, I'll share it with you guys what I think. There's very likely that we're going to have multiple vaccines out there, and there may be some that are better than others. We don't know. Do I believe that there'll be a vaccine ready to be given in November? Absolutely not. And I'm not, I would not take it if, unless really the safety profile really met muster. And I think it's almost impossible to say that it will that quickly. I want to talk a little bit more about long-term cases, long haulers. We're starting to, in my clinic, we actually have some protocols where we work with Alzheimer's patients and traumatic brain injury patients, utilizing a protocol to optimize brain hormones and things like that. And we have very, very good results with that protocol. And we've had more and more people contacting me about sort of COVID brain and brain fog afterwards. And so we're starting to implement in the clinic a protocol to help people that are having brain issues after having COVID. It's a protocol I'm developing kind of as we speak, and so we'll have to study it and we'll have to see how it goes. I'm utilizing a protocol that works well for dementia and brain injuries, and I think that it will work well because the damage from COVID is oftentimes very similar to some of the damage, especially for traumatic brain injury. So I'll keep you guys updated on that. There was an interesting study out of Austria looking at pulmonary damage from COVID, and what we're finding is, I think that, is it 1 in 3? I wrote it down here someplace. Let me make sure I say the right thing. But I think it was 1 in 3 hospitalized patients have sort of, with severe COVID, end up having prolonged pulmonary symptoms. And there was an Austrian study that was done looking at people that were admitted with severe COVID, and they followed them at 6 weeks and 12 weeks late after, looking at pulmonary function. And what they found at 6 weeks, 88% of those people had CT evidence of lung damage, and 47% still had shortness of breath 6 weeks after they were discharged from the hospital and had COVID. And at 12 weeks, 56% still had CT evidence of damage, and 36% were still having shortness of breath. So these symptoms can last for a long time. We've talked about COVID long haulers. We, my wife and I personally have a very good friend who's dealing with this as we speak. And she actually had a pulmonary function test that showed obstructive lung disease, which is basically like COPD, related to her COVID exposure months ago. The good news is it does look like these things heal over time. So I think there's reason to hope, if you've had COVID and are dealing with these long haul symptoms, there's reason to hope that they eventually are going to go away. We don't know a lot because it hasn't been around that long, and unfortunately, we're learning new things every day. But I'm hopeful that I'm not the only place that's doing some things with the COVID brain, and hopefully we will learn by trying different protocols and be able to find some treatment regimens that hopefully will help people with all these sort of post-COVID syndrome type symptoms, because as cases go up, more and more people are going to be suffering from this, and we really want to be able to have some reasonable therapeutic options for that population. I'm going to stop it there. It's been a very, very difficult couple nights. It was really, really busy last night. I don't know if anybody out there works night shifts, especially night shifts in an emergency department, but they do wear on you after a while, and I think I need to go home and take a long nap today and try to enjoy the last little bit of the holiday weekend. I will be back later in the week. We're going to be talking about part 2, sort of the estrogen, progesterone, hormone replacement talks this week, and then we're also going to be doing one on testosterone and one on thyroid coming up. I'll do some more coronavirus things. I will share a little bit more of this protocol that we're putting together for COVID brain. If that's something that you're having issues with, please contact me at the clinic and we'll see if we can help. As usual, please subscribe, like us if you think of any value at all to you. Wash your hands, wear your masks, look after yourselves, look after your families, look after those around you. If we work together, we will get through this. Happy Labor Day weekend, and I will talk to you all soon. See ya.